Yeah, so I'm from the United States originally. I have a background in environmental sciences. Went to school for it and started traveling kind of after high school into college, and came to Laos and absolutely fell in love with it and wanted to start a conservation project there. So started an elephant rescue and conservation center. Been doing that for about 8 years now and absolutely love every minute of it. Most of my life is running through the jungle and checking on the elephants, and very labor intensive. The medical care in Laos is very substandard. So whenever I need to see a doctor, I'm actually not sure how I injured my spine in the first place. It was about 8 months ago, I'd say. I started feeling numbness and tingling in my legs with kind of a sharp shooting pain in my lower back. And it just continually got worse and worse until the point I realized there was something clearly wrong. So yeah, figured I needed to get it checked out because something was not right with my spine. So it could have been some small injury, and I just kept running through the jungle and living my life like normal, and it just kept getting worse and worse. So yeah, decided I needed to come and have an expert look at it. I did, yes. I went to another hospital and they ran quite a few tests to determine what was causing this pain and numbness in my legs and in my back. And they did suggest that I needed a surgery to repair a herniated disc in my lower back. The surgery they recommended, after doing some research on my own, was myself. So wanted a second opinion, so I came to Bangkok Hospital and met with a few of the different surgeons and found the surgery I thought was perfect for me, that fit what I was looking for, and decided to stick with Bangkok Hospital and get the surgery done here. I think for many reasons. One of my best friends, who I started our elephant conservation project with in Laos, got in a very bad car wreck about 6 or 7 years ago, and he needed to be airlifted to Bangkok Hospital for medical treatment, broken femur, ribs. I can't even remember how many things were broken. He was in really, really bad shape, and got such amazing medical treatment here. Could not have spoken about it higher, and ended up having to go back to the States after the surgery, the United States, for full recovery. And even the doctors there were amazed by how good the surgeries were done. So yeah, Bangkok Hospital was always the top of my list, and coming here, the service and everyone I've met has been so friendly, and the doctors, and it just, yeah, felt like a better place to have this surgery done. Felt like the right place.
The patient was diagnosed as having a lumbar disc herniation of L5 and S1, which was treated by medication, physical therapy, and also the epidural injection. But those methods failed to help him, and later he was suggested for a surgery. And I think he's been researched a lot about the various methods of treatment, from the open surgery, microscopic surgery, and endoscopic surgery. And he found out that the endoscopic was the least invasive surgery, and then he came to our hospital to seek for this treatment. The endoscopic discectomy was carried out. Roughly, we made a small incision, about 7 to 10 millimeters, and we inserted a dilator, and also the endoscope, which we have various of instruments to remove the this part out. And the surgery took around 30 minutes. Since the endoscopic spine surgery is the least invasive method to deal with this problem, so the main advantages were smaller wound, less post-operative pain, faster recovery, and also quicker return to work as compared to the conventional method.
Better than I had in months and months. Literally just right after the surgery. I came out of the recovery room, went back to my bed, and I wanted to get up and walk around and go start doing things. Unfortunately, it was advised against that I don't start walking till the next day, but yeah, even after an hour after the surgery, I was ready to get up and move. And the next morning, I would say 90% of the pain had already diminished, and I was already walking better within, 12 hours than I had been in 6 months or so. Yeah, it's good. So one of the doctors from the rehabilitation clinic here picked me up the following morning after surgery, gave me a basic routine, mostly just work on my legs and core strength that I could kind of begin with for the rehab process. So it starts off slow. The one thing that I have to be most careful of is not pushing it too hard, because it's quite easy to re-injure the disc, to re-herniate it. So it's going to be a slow progression, the recovery process, but it's going very well. Again, like no pain, just basic stuff. And so yeah, there has been a little bit of limitation. Working at an elephant conservation project and running through the jungle and often lifting up really heavy things and bending over, and so I haven't been able to fully resume my daily life routine as it was without risk of re-herniating the disc. That'll probably be 6 months or so before I'm fully back. But yeah, as far as waking up with no pain, being able to walk around, 100% recovered in that regard, but not the running through the jungle and lifting up, heavy objects. That'll take a bit, but in general, my life the day after was pretty much back to normal on a basic level. There were many things, just how well it was coordinated. I saw a handful of doctors in the course before being approved for surgery here at Bangkok Hospital, and having them all come in and check on me before and after surgery just showed how much that the doctors here really care about their patients. All of the staff and nurses that came to see me, it was constantly just feeling welcomed and reassured. It really took any level of anxiety or being scared about the procedure just kind of disappeared. Everyone was so friendly, and it didn't even feel like surgery. It was kind of just a short blip where I, went into the surgery room and woke up and immediately felt better and was surrounded by people who were caring and helpful. And Dr. Rit was so confident with how the surgery went, had already spoken to my parents that were there. And yeah, just overall, it was a wonderful experience. Well, I don't want to have surgery again. Maybe not wonderful isn't the right word, but as far as I could imagine a surgery going, I couldn't ask for a better experience.
Right after surgery, the pain was decreased significantly. The patient was able to get up and walk right after the surgery, and the hospitalization was one night. The next day, he could go home and return to his daily activity. And the most important part is that the surgery resulted in no complication intraoperatively and postoperatively. The patient needed to go back to his activity as soon as possible, so the least invasive method would be his answer and his solution. So we performed the endoscopic spine surgery for him. First is the correct and accurate diagnosis. Second, the method we chose, which was the least invasive surgery, which served his preference. And third, the cutting-edge technology of endoscopic instruments in our hospital and the facility in our hospital. Those are the key elements for success.